Hello, everybody. This is Jacob Bilecki from Collaborative Consulting. We're just going to wait for another few moments for a few more people to enter into the webinar, and then we'll get started. All right. Paula, do you want to kick things off?
Sure. Good afternoon, everybody. It's nice to see you all here. Thank you for coming. My name is Paula Jones. I'm Director of Food Security for the Department of Public Health. And I want to thank you all for your interest in CalAIM, medically supported food and nutrition. And thank you for attending this webinar. This work is a collaboration between Department of Public Health, the Food as Medicine Collaborative, SPUR, and collaborative consulting with the program management support from the Public Health Foundation. Now, the purpose of this webinar is to provide you all with some background on CalAIM as it relates to potential opportunities to support food for patients, and then give you a summary of this capacity building initiative, basically what's been done so far and what is coming next. And then this readiness assessment will be discussed and demonstrated, and we'll discuss how it can inform your organization as well as be used in this capacity building initiative. So next, I'd like to introduce the project team. And as I'm doing this, please feel free to introduce yourself in the chat. From Department of Public Health, in addition to myself, we have Dara Papo, Director of Whole Person Integrated Care, and Kathleen Reed, who is the CalAIM Community Supports Program Manager. We also have the Food as Medicine Collaborative. We have Erin Franey and Dr. Rita Nguyen. Then from SPUR, we have Katie Ettman. And from Collaborative Consulting, we have Jacob Bilecki and Lori Peterson. Sorry, Jacob, if I butchered your name. And also Allison Berger for help. And also the Public Health Foundation is providing project management assistance. So after that, next, we're just going to have Katie will provide more information about CalAIM and medically supported food and nutrition. And Erin Franey will then, after that, give you more information about this capacity building initiative. And then we'll turn it over to Jacob to demonstrate the readiness assessment and how it'll be used. Now, just a little bit of housekeeping. We'll have time at the end for Q&A. And people can raise their hands or add questions in the chat. And those chat questions will be monitored by our colleagues at Collaborative Consulting. And now with that, I'm going to turn it over to Katie.
Awesome. Thanks so much, Paula. Really excited to be with you all today. Like Paula said, hi, Katie Ettman. My pronouns are she, her, and I work at SPUR. I'm excited to be a part of this project team. So first, what is CalAIM? It's probably a question a number of you are asking, or maybe you have a brief or like nascent understanding of CalAIM, but at a high level, it is an opportunity for states to apply for exemptions to Medicaid rules. And those are known as Medicaid waivers. And so here in California, that looks like the Department of Healthcare Services, who oversees Medicaid, which we call Medi-Cal in California because we rename everything, applying to the Centers for Medicare and Medicaid Services at the federal government to test out new and innovative ways to provide healthcare. And so in California, like I said, we rename things. And so we call our waiver, which is a comprehensive 1115 and 1915B waiver, which you don't need to know, CalAIM. And the exciting thing is that waivers like this have been used in states across the country to offer food-based interventions. And so California looked to some other innovative states like Massachusetts, North Carolina, and Oregon to set up this new and innovative approach to healthcare. And we can pop to the next slide. And so within CalAIM, this waiver application, the Department of Healthcare Services also included this entire section that they now call community supports. If you've been tracking CalAIM for a while now, you might remember the old language. It was previously called in lieu of services, or ILOS, but they've since renamed it to be more user-friendly to community supports. And as this first bullet point here points out, these are cost-effective alternatives to traditional medical services. And so this is a way to say, hey, originally you might have been provided with a community health worker coming to your home and helping you prepare meals after you've been released from the hospital. But a cost-effective alternative to that might be getting a medically tailored meal delivered to your home. So it's this idea of sort of swapping out one-for-one services that are cost-effective and helpful to a patient's needs. And so California has looked at this in a pretty expansive way. And so they're also looking at the ability to go, okay, maybe earlier in your care, there is a reality in which you might have diabetes. And so down the road, you might have some pretty expensive healthcare needs. And so a cost-effective alternative might be having healthy food up front instead of paying for really expensive care in the future. And so within the Department of Healthcare Services, there has certainly been an emphasis on the housing supports that you see listed on the right-hand side. But there is a menu of 14 potential community supports. Obviously, today we'll be focusing on medically supportive food and nutrition. But if you're interested in more information about these, feel free to go to the Department of Healthcare Services website. And then last, and potentially the most important part of community supports, is this final bullet point, which talks about the fact that Medi-Cal managed care plans, so our health plans here in California, are only encouraged to offer as many of these community supports as they can. It is not required. And so it is up to the health plan to opt in to these different types of innovative supports and also identify which populations they're going to serve. And that brings me to the next slide, which is who is eligible for different community supports, and in particular, medically supportive food and nutrition services. So the paragraph you'll see here with all of these different chronic conditions is included in the CalAIM waiver. This is the exact language from there. And you'll see that it's a pretty broad spectrum of chronic diseases that these services can provide and help with. And so that means that it really is important for the health plan and the potential provider to work together to find the best possible population fit to the intervention. And then maybe even more importantly, at the top of the slide, you see here, like, what is medically supportive food and nutrition services, what's included under CalAIM. And really, these are food-based interventions to help prevent, reverse, and treat chronic disease. And so you'll see a list of them to the right-hand side with what are those 7 medically supportive food and nutrition interventions. But we'll also take a minute and dive more fully into those in just a second. And so one of the important things I want to note about before we get into the interventions is that within medically supportive food and nutrition and in the waiver in general, you can't provide these services just because someone is food insecure. This is Medi-Cal, this is Medicaid. And so what that means is that we are really looking at health conditions. And so while we understand that food insecurity can harm your health outcomes, you also have to have an additional chronic disease or other listed item here that is pretty flexible. And because this is not just a food security intervention, it's important to note that Medi-Cal is often known as the payer of last resort. And so what that means is we can't supplant other things. So you're not going to say like, oh, this individual is already receiving SNAP or CalFresh, formerly known as food stamps here in California. And so obviously, if someone's on SNAP, they're getting money there to be able to access food to improve their health outcomes, but that might not be enough for them to be healthy. And so this would be on top of or in addition to those benefits. And so you wouldn't say, oh, I'm getting medically supportive food and nutrition, and so I no longer need SNAP. So there is this question of building on top of, not supplanting other innovations. And we can hop to the next slide. And so this graphic here is one way to represent those 7 medically supportive food and nutrition interventions that we've been speaking about. So working down the left-hand side, you'll see there are sort of 4 types of grocery-esque programs. The first is medically tailored groceries. And what's important to note there is the medically tailored indicates that there is a registered nutritionist, dietetics nutritionist, RDN, got to get the right acronyms, who's helping tailor those groceries to a patient's individual needs based on their chronic condition, maybe the medications that they're on, et cetera. Then we have medically supportive groceries. Similarly, these are healthy groceries, but they aren't tailored by an RDN. Then we have food pharmacies here, which we think about as being typically co-located in healthcare. So you're going to get groceries, maybe it looks like a farmer's market in a clinic or hospital. And then last on that groceries list is produce prescriptions. And so this is the idea that you get a voucher or a card to go to a local retail environment, maybe that's a grocery store or farmer's market, to get access to free fruits and vegetables. And then on the flip side of this graphic, you'll also see meals. So similarly, medically tailored meals are tailored by an RDN. Medically supportive meals, not necessarily tailored by an RDN, but generally healthy for the patient. And the last and important intervention you see down here at the bottom, behavioral cooking under nutrition education, sort of the wraparound services in order to really elevate the impact of the food. And so these can be paired with any of the 6 interventions above to amplify those effects. So that's how we have thus far thought about this broad spectrum of medically supportive food and nutrition. And part of the reason that we love going about it in this really broad way is we want the people who are prescribing these interventions to patients to be able to match the acuity of someone's need to the sort of intensity of the intervention. So I think one of the great examples is, say you are dealing with cancer or you've just recently been released from the hospital. It might make a lot of sense to provide a medically tailored meal, a home delivered meal right there, particular to your needs. But let's say you have gestational diabetes, you're still going out, taking care of your own grocery shopping, a produce prescription might be a better fit. And so we want to make sure that there is flexibility across all of these different interventions. And so we're going to go to my last slide before I kick it over to Erin. And that is the current landscape here in San Francisco. So there are 2 health plans that serve San Francisco. You can see over here, San Francisco Health Plan has just over 160,000 patients that they work with. Anthem has just over 22,000. And you'll note that both of them are looking to implement medically supportive food and nutrition and a slightly different timeline. And so this information is available not only for San Francisco, but for the rest of California on the Department of Healthcare Services website. And the only thing I will note is that within that website and the chart that you can look at, it says it lists the 14 community supports. But as we just described, medically supportive food and nutrition refers to a spectrum of interventions. So while a health plan might check that box, it doesn't mean that they're offering all 7. They might just be offering 1 intervention. And so while it is a helpful indicator, it doesn't necessarily tell you the full story of what folks are opting into at the health plan level. So I know that was a whirlwind of information about CalAIM and community supports, and I threw out a ton of acronyms. So before tossing it over to Erin, I just want to say this webinar is really focused on the second half, the readiness assessment. But if anyone on this call wants to do a deep dive into CalAIM and have a further conversation, I'm happy to provide that for folks. So thank you, and I'll toss it over to Erin Franey.
Awesome, thanks, Katie. So our long-term goal is that food and nutrition services become covered benefits under Medi-Cal. And what that means is that we hope they will transition from being optional benefits that plans can elect to offer patients to being part of standard benefits that all plans in California must offer to all eligible patients. And so that's that long-term statewide goal. And then we also have goals that are specific to this capacity building initiative with collaborative consulting. We want to ensure that medically supportive food and nutrition services reach as many Medi-Cal beneficiaries in the city as possible in a way that is easy to access, culturally relevant, and promotes dignity and patient choice. And these services should be sufficiently available and well coordinated. And so a critical step we recognize to achieving that vision is building capacity among organizations like all of you that are here today that are already connecting San Francisco residents to healthy food to help navigate the legal, technical, and financial requirements involved with contracting with health plans. So the goal of this partnership with collaborative consulting is to support the ecosystem of food and nutrition community-based organizations that are doing great work in San Francisco to further prepare everyone who's interested in partnering with health plans and healthcare to be reimbursed for services via community supports. And so we also want to and hope to support opportunities for collaboration across organizations to really leverage our collective resources and expertise to make implementation of medically supportive food and nutrition services as impactful for patients and sustainable for organizations as possible. So kind of thinking about more back into the long-term and capacity building. Next slide, please. So then in the short term, we are working to share this opportunity with organizations, starting with today's webinar. And then in the weeks ahead, we will ask those organizations interested in participating in capacity building to fill out a readiness assessment. And that will help collaborative consulting in designing capacity building resources and tools that will be available to all organizations, in addition to more tailored technical assistance to a smaller cohort of food and nutrition organizations in San Francisco. And Jacob will be talking more about the readiness assessment in a few minutes. And then on the right-hand side of this slide are the selection criteria that the project team will use to select the organizations to participate in the small group and individualized technical assistance. And so at the organizational level, we're looking for organizations who are interested in and can commit to participation in the capacity building program, who have varying degrees of readiness to enter into contracts and subcontracts with health plans, who have experience serving populations disproportionately impacted by diet-related diseases. And then across the cohort, we're also hoping to have a spread and representation of the different medically supportive food and nutrition services that Katie had walked through in that previous slide with the graphic, and for the cohort's potential ability to serve all San Francisco neighborhoods and capacity to reach most people. And so on the next slide, we have a visual of the timeline for this project. So we are currently in phase 5, and that is when we are conducting and opening up this readiness assessment and analyzing the results. We anticipate beginning the capacity building in the later part of this year, which could go into early 2023. I just wanted to note on this slide about the time commitment we're anticipating for the cohort selected for that small group and individualized technical assistance. We're thinking that everyone who's selected should expect to devote between 10 and 15 hours per month on learning and development activities. So just keeping that in mind, that's part of the selection criteria, is your organization's capacity to actually give that much time to be part of this smaller cohort. Thank you so much. I am now going to pass it to Jacob to talk more about the readiness assessment.
Thank you, Erin. And hello, everybody. It's great to be with you today. And today is actually the official launch of this next phase of work for this project, which is a CalAIM readiness assessment survey that we will invite all of you to complete. And this, again, will help inform the types of tools and resources that we will be developing and that will become free and publicly available to any organization looking to learn more about and develop their capacities and capabilities around contracting with health plans in the CalAIM context. This readiness assessment survey will also, again, inform what the smaller cohort of organizations would look like, and what that direct capacity building support will also look like. It will be a combination of direct one-on-one technical assistance and small group workshops focusing on very specific areas within CalAIM healthcare contracting and organizational planning and readiness. And then the third purpose is really for you, and we invite all of you to take this assessment, even if you're sort of scratching your heads right now, not really sure what's going on with CalAIM or if it's right for your organization, but to take this opportunity to go through this assessment and engage with the introduction, the orientation, and the questions to maybe get a better sense of where this might fit, where this opportunity might fit for your organization. If your organization is farther along on the CalAIM readiness trajectory, we would still very much invite you to take this assessment as a way to maybe get a sense of where you are at and what you might need to continue along that pathway. And so what I'll share with you is after you take the assessment, you will have a report of all of the results back to you immediately after you take it. So you will have a record of your responses that you can use internally to inform some of your strategic and tactical decision making. And And so I will demo the assessment in just a moment. We'll also share a link to the assessment in the chat toward the end of this webinar. And we'll also share with you how you can access the assessment outside of this webinar, of course. In terms of engaging with the assessment and executing it, we would invite that you first get into it and take a look at what it entails and what it's asking. We invite that you do give it an appropriate amount of time and attention, because it is rather it's technical, it's tactical, and it's strategic. I think you'll find in going through it, it's a very valuable experience. And we would invite that you include maybe not only your executive director or your CEO, but the executive leadership team that might have different perspectives on where your organization is at in terms of its readiness or its strategies for contracting with the health plans. And so that might include a program director or manager of your food nutrition services, maybe your CFO, maybe if you have some board members that are very involved in your work that are also very familiar with the inner workings of the organization and its capacities, things like that. It's a great opportunity to have a dialogue about this new orientation to doing business and to doing work. And we see that organizations that take the time and bring staff in to this process get way more out of it than just the results of an assessment. They end up really talking about things that they're not used to talking about around strategy and readiness across many domains of the organization. So I just want to advocate for that, if you can, to include your other colleagues in reviewing and completing the survey. We anticipate that it should take 45 to 60 minutes to complete. There are 23 specific questions in the survey that are a combination. There are a couple of open-ended questions, single choice questions, and then some multiple selection questions that you'll see in a moment. And then we will just wanted to share a disclaimer that any of the data that is being shared in this assessment will not be shared with anyone outside of our project team at that organization level. So we won't be individualizing the data outside of our own analysis to understand what the landscape and ecosystem is looking like in San Francisco, and that any data that is shared will be anonymized and aggregated. So I'm going to move over to our demo of the tool here. So this is the first page. This readiness assessment survey lives online. It's through a platform called FormSite. My colleague Allison will be sharing the link once we get into the Q&A, so you'll have access. You'll have an immediate opportunity to get into this and take a look. The first page is really an introduction to sort of what we covered in this webinar about the background of CalAIM and the purpose of this initiative and the purpose and function of the survey. The only required question in the entire survey is the name of your organization. Everything else is optional, but we highly encourage and sort of want to stress that the more information we can gather, the better we can design these resources and tools for all of these organizations. So we do heavily encourage you to complete the entire assessment. Because it can be somewhat time consuming, 45 minutes to 60 minutes, there is an option to save your progress. So if you do start it and you want to come back to it, if you press the Save Progress button, you can create a username and password that will be sent to you that you can access and retrieve your survey results. You can pick it up where you left off. And so my fake organization, the Broccoli Brothers, I'm going to go into the assessment, and there are 6 sections to the assessment. The first is really just about your organization. So we ask about sort of the relative size of your organization in terms of staff and budget, and the geographies that you're serving throughout San Francisco. The second part is around healthcare partnerships. So we ask if just your level of familiarity with the CalAIM opportunities, existing or desired partnerships with healthcare organizations at this moment in time, and some other orientations to the healthcare sector that your organization might have. The third section is around your programs and services. So what types of services and programs does your organization offer? And then we also want to hear a little bit about the populations that you're serving, that you're targeting, and that you're serving, and the ways in which your services and practices are culturally and linguistically competent. And that's a lot of these questions are coming directly from CalAIM policy and what the health plans are looking for in partnerships. And so most of these questions are derived from what is asked for, expected, or required of these partnerships. The fourth section is around administration and operations. So these are things like your data management systems and practices, HIPAA compliance, staffing and infrastructure, and other various sort of administrative and operational capacities. The fifth section is around financial acumen. And in this section, we're really just asking about the way in which you cost your services. So how do you understand your own costs? The way in which you can manage or you practice managing costs, and the way in which you may price your services. And I do want to sort of make a caveat that there are no expectations in this assessment that your organization is doing all of these things actively or to the level of expertise. What we're trying to understand is where your organizations are at in this moment in time, and what tools and resources and support do you need to be able to build on these competencies. So I just wanted to say that caveat that there's no expectation, and that the decisions that will be made for the smaller learning collaborative cohort will not be dependent on necessarily on the expertise of organizations coming in. So we do invite you to respond to the survey in the most candid and accurate way possible that immediately reflects your organization. The last section is really going pointed in the direction of the design of our tools and resources and the capacity building support that we're offering. The first is a simple question about if your interest and availability in participating in a capacity building initiative. And then the very last question of this survey is asking about the types of areas of focus that you're particularly interested in developing or learning more about, and then the ways in which you would prefer to learn or develop those areas. So for example, just a drop down here, we have these sort of core categories around CalAIM and contracting readiness that we've identified with another category as well. And so let's say that we wanted to develop, at the Broccoli Brothers, we wanted to develop our HIPAA compliance, and we were particularly maybe interested in case studies of best practices of other organizations that have built up a HIPAA compliance program from the ground up, let's say. And so that would be one. What we would be doing on the back end is then really learning about what all of your organizations are looking for, identifying trends, and using that to inform the design of our resources and tools, and the design of the capacity building program and one-on-one technical assistance for organizations. So after you've completed the survey, you can click the submit button, and then it goes off into the database. And this also allows you to print out a receipt, basically, of your all of your responses. You can also download this. If you create a profile in the portal, in the FormSite portal, you can log in and access your completed assessment at any time. And if you lose your information, or if you maybe you get sidetracked and you have an issue of accessing, you can certainly reach out to our team, and our contact information is in different parts of the assessment, and we will certainly help you re-access your account or access your results. And so this is how you can access the the assessment. It will be on the Food as Medicine Collaborative website, a link to this assessment. We will also be posting it in the chat momentarily. And then you can also email our team. Allison is our contact person. And her email will be in the assessment as well if you have any questions or issues as you get through it. So in terms of timeline, again, the assessment is sort of now officially live. We just launched it. And we're asking that all organizations complete and submit their assessment by 5 p.m. on Monday, August the 8th. And again, if you do have any challenges or issues with it, please do not hesitate to reach out to us or members of the project team, and we'll get things answered or sorted out as soon as possible. And like I said, you are able to save and return to that assessment by selecting the Save Progress button. And that, I believe, unless I've missed any details, that I believe is a wrap. And Allison, if you're ready, or if you want to drop that link in the chat, and I think at this point we can open things up for Q&A. If anybody has any questions at all about anything that any of us have mentioned in this webinar, we are more than happy to answer. And feel free to raise your hand or add a note in the chat. It looks like Andy has a hand raised.
Yeah, thank you everyone for the background. I have a quick question. Where does the funding origin for this capacity building opportunities? I'm just curious because why it's limited to San Francisco. We certainly can work in San Francisco, but are primarily focusing our energies in San Mateo County on CalAIM things. So just curious why that's been targeted.
Yeah, I can take that one. Thanks, Andy, for that question. We're targeting for San Francisco because this is actually funded through funds from the city of San Francisco. So that's why we're really intending to support CBOs that work in San Francisco.
That makes sense. Thank you.
Any other questions? I'll also kind of look back at the team and see if there's any other details that emerge that we might want to share or anything that popped into your heads along the way.
Hey, Jacob. I had some questions just around the definitions for the medically tailored meals specifically. Do we know, like, is medically supportive still considered like edited from a nutrient perspective? So something like meals that are all under a certain amount of sodium, right? Say like 1,500 milligrams or less for a 2-day meal pack or something, or would that fall into medically tailored? I'm just wondering, like, is there any review or like nutrient restrictions for that, or is it just kind of saying like this fits into an eating pattern that could be considered generally helpful, or is medically tailored like patient specific?
Yeah, great question, and I'll defer to Katie or Aaron on that one.
Yeah, I'm happy to hop in, and Aaron, please correct me if I miss anything. So one of the first things I'll do for you is pop into the chat. One of the fabulous partners on this work has been organizations that are part of CalFIMIC, which is the California Food as Medicine Coalition, who support, I think it's 9, if I'm wrong, sorry to my lovely medically tailored meals folks on the call, 8 organizations, community-based organizations who provide medically tailored meals. And so they'll have the most up-to-date information with the official definition from both the state and then national coalition that works on medically tailored meals. But I would say at a basic level, very basic, it is the involvement of an RDN to a particular patient in their current situation. Aaron, would that also be how you would put that, sort of as simply as possible?
Exactly. Yes. And so they're looking at their diagnoses and other factors, and then identifying a meal or meal patterns that will be best for that patient versus medically supportive, as you sort of described, broadly healthy but it's not tailored to the individual. Does that make sense?
Yeah, got it. Thank you. And because I think like a lot of the CBOs probably are doing some type of service that falls more in line with a medically supportive meal, medically tailored, brings my mind back to like an inpatient tray line a little bit more. But cool. Thank you for the general context, and I'll look closer at the definitions myself. I appreciate it.
Yeah, of course. And I would agree. I think there's a lot more folks who work in sort of the more medically supportive space, but then we're incredibly fortunate we have this great statewide org who helps organize on the tailored portion. And I'll hop in. I see another hand, Allison.
Hi, I don't know. Can you hear me? Am I on?
Yes, it worked.
Cool. Yeah, this is really exciting. Thank you all. Thanks particularly Jana and Aaron for bringing Farming Hope into this work. Curious, as we were listening, kind of compared to what we're doing now, this seems like a really big pivot and a big lift, which I'm happy to do the assessment and share more about. I'm kind of wondering, like down the road, what sort of contract size are we looking at? What is the intention? How many meals or how many groceries a month for CBOs? Because as we're looking to, invest and getting ready to implement this kind of change, I want to make sure that at the end of the day, it's worth it for the organization. So trying to get a little bit of a sense of what you think the scope and scale is going to be.
Okay, I'll start and then others can add in. That's a great question. And in learning from other folks around the state who are trying to do this with other health plans and other counties, there have certainly been a lot of challenges. And I think part of what we're trying to do statewide is elevate some of those challenges to the Department of Healthcare Services to really improve the guidance on how community supports generally are implemented and how health plans are working with community-based organizations to provide these different services. So it is not a perfect system right now and has a lot of room to grow. And so just wanting to be clear about that up front, that it hasn't been easy. I would say even for the most advanced, like medically tailored meal providers in the state, it has been, I think, a struggle to work with the same health plans that they've worked for in other capacities to go under community support. So I think there's some advocacy that needs to happen and policy change that Katie and others on this call are helping to sort of lead at the state level. I think locally, our goal, as we had in one of the slides, is that the San Francisco Health Plan and Anthem elect to offer the full range of medically supportive food and nutrition services and adopt a very broad eligibility criteria, which is happening in other counties. We do have some good examples of that. So I think that's what we're hopeful for. And that probably, and I think this is probably true in other counties, that we will all be learning and growing simultaneously. So the plans are going to get used to this, healthcare providers are going to get used to this, patients are going to get used to this, and we community organizations will get used to this, and it will grow. But I do think, wanting to be realistic, that at the beginning, I think it's going to be a lot of work, and I think it's going to be small numbers in terms of like actual patients who are referred and connected, would be my sense. I don't know if others have different opinions or similar opinions.
No, I think that's right, Erin. Thank you. And thank you, Allison, for the question. I don't think we know. And that's really where we're at. We're not clear, but we do believe that if more organizations are ready, that will help with possibly opening up more opportunities.
And I'll build on that slightly. Exactly. Until we actually identify what the qualifying criteria are, it's really hard to know. So say you're in a negotiation with a health plan and they go, oh, actually, we really just want to focus this on folks with cancer. Might be a relatively small population, depending on what type of cancer, et cetera. And so that might not be that many grocery boxes or medically tailored meals. But at the other end of the spectrum, they might be like, actually, we understand that medically supported food and nutrition could be a huge bolster to our population who has pre-diabetes. And that could be a huge swath of the population that they serve. And so I think there's also a piece of potentially this technical assistance. And if this sounds helpful to you, to understand, here's the intervention that my organization or I provide, here are the healthcare problems or diagnoses I think we are best fit to sort of serve that population, and then matching those up and pitching that. And so I think there's going to be a real learning curve for both the community-based organizations about how best to tailor this to a population. And then for the health plan to be like, okay, let's talk through how to make that possible so that we're meeting as many patients' needs as possible in a way that makes it worth it to the community-based organization and improves patient health. The last thing I'll throw out in the same vein that is not exactly to your question, Allison, but I would be remiss not to mention, is that CalAIM is technically in place for 5 years, like I said in that overview. And so one of the things that Aaron spoke to this entire time is right now this is in pilot phase, and we want to see it be successful so that we can transition this to a full covered benefit. And so while there's maybe a lot of upfront work, and we acknowledge that for those who end up in the smaller capacity building cohort, it's a lot of hours a month to be able to do this, but with the idea that you will set up at the start sort of one-time costs, sort of figuring out your processes, and that hopefully if we're successful now, improve that success and become covered benefits, this is a sustainable funding stream for programs and implementation like this into the future, much beyond those 5 years if we're successful.
Yeah, and I'll just reiterate or make an important distinction that this is kind of a competitive environment to some degree, meaning that the plans, like Katie said early on, they can choose basically what they want to offer and who they want to work with, and to some extent prices are also negotiable. And so there's a sort of a strong entrepreneurial element to this that makes it maybe more experimental and innovative than a traditional grants-oriented approach to a program or service. But I'll also say both health plans have demonstrated a significant amount of interest in making it successful and wanting to work with local community organizations. I think we've heard that across the state, but specifically in San Francisco as well. And so I think there are more tailwinds than headwinds for the opportunity. I just wanted to also make a side note that there are also kind of peripheral opportunities that are emerging that might also work on the tailwind side of things in terms of other trends that are happening in healthcare that are just reinforcing the need for food and nutrition services for patients or members of health plans. And those are still, I think, more emerging than what's happening in CalAIM right now in California, but it does sort of tie into this maybe longer picture horizon about this kind of new reality of more integration and coordination among healthcare organizations and community-based services organizations. It looks like, let's see, I'm just looking at the chat here.
And I think Aaron just answered Andy's question from the chat. The other thing I'll uplift, thank you, Sissy, in the chat box talking about adequate reimbursement rates. And so I will just flag this for other folks who are maybe less familiar. The Department of Healthcare Services put out rate guidance for all 14 community supports. And in addition to that, not only rate guidance, but also some technical language and coding for how to implement these. And so with a group of, I believe, about 30 other organizations in California, some community-based organizations wrote to the Department of Healthcare Services and let them know that we thought lots of those rates that they proposed weren't high enough to cover the true costs of these different interventions. But the Department of Healthcare Services was also very upfront with the fact that it is guidance and that there is individual negotiating. And so actual costs are decided between the community-based organization and the health plan and negotiated. So while it is not a perfect system, that does exist, and I think is definitely something worth flagging for folks. And I spy another hand. Adrian, do you want to hop in?
Yeah, I mean, two things. Number one, I think what we're seeing in other counties is that there's a dependency that is like caseload for other groups of populations like ECM. And when those like, so like, for example, in one county, there's an issue where the number of contacts that is paid for by the health plans for ECM clients is too low, that there's just simply not enough time and not enough ability to even get these patients to a point where they could be referred into a medically supportive nutrition program. So we had thought we'd already be doing this in San Diego, but because there's so many problems on the ECM side and it's almost like a difficult business case for ECM providers, that's the bottleneck. It's not so much like capacity or readiness on our part, it's this like referral pipeline. And, you know, just reminded me what was just said about, you know, negotiating with the health plans. I mean, that is like not happening. And the people that are managing the contracts are like not the people that have any ownership over managing the prices. And you just, so I'm just seeing this like huge disconnect. It's just sort of a merry-go-round of like passing the buck. Nobody has any ownership. Nobody has, I'm like, I'm not even sure where the power differential is on the individual case. Like I get it at an organizational level, like I have no power, they have it all, but like, you don't even really know who to talk to. So I just kind of wanted to highlight that our experience has been less about readiness to deliver the intervention and more about inability to get referrals or like have a conversation with somebody who is in a position to make a decision. And so that's felt really frustrating for us. And we're hoping that San Francisco is different.
Yeah, I want to thank you for those comments. And I would say we would love to see you articulate that in the readiness assessment, because I think it's a real opportunity in some ways to go, is there some way that we can interrupt this referral problem? Can part of our technical assistance address that? Like those are the problems we want to hear about to figure out ways to work with. And I see Jacob nodding good. I didn't put him out anyway. And yeah, so I think it is not linear. It is complicated. We are learning together. For those of you who have heard me on other webinars, you might hear my like habitual joke, which is CalAIM is building a plane while flying it. There's a lot of moving parts. And so I hope that we'll be able to overcome some of those barriers.
Yeah. I just wanted to add what Katie said in that, and to encourage folks to put in the comments if possible, because the readiness and building readiness and capabilities and capacities is probably not much around the delivering of the intervention, because folks have been doing that for decades. So it likely is around building the business, business development, negotiation, contracting, stuff like that. So please do put those comments in the assessment. So Katie, I just wanted to reiterate that.
Allison, could I ask you to put the link in the assessment, link of the assessment in the chat one more time? And what we will do is we'll also email this link out to everybody who has registered for this webinar. So you can also get it in your email this afternoon. And you should have also access to our contact information if you do need it. As you get into it, again, we invite and encourage all of you to review and complete and submit this assessment. It will be sort of instrumental in helping design these capacity building tools and resources. I think at this point we'll just sort of do a last call for questions, and if not, we can wrap a few minutes early. All right. Well, thank you so much for your time and engagement with this, and we look forward to having you engage with our readiness assessment. And by all means, please do be in touch if you need any assistance with it whatsoever.
Have a great weekend.
Happy Friday.
Thank
Thanks,
you.
y'all.
Thank you, everyone.
Thank you.
Thanks, everyone.
Thank you.